Good morning. Wow, I am honored to have been invited to speak to you today. I wish to thank the Hispanic Dental Association, the Joint National Conference on Hispanic Health, the HDA faculty members, and honored guests for giving me this opportunity to speak with you today. I apologize for not being here in person, but with the help of technology and this meeting's media personnel, I hope to deliver a presentation worthy of your attention. First, I wish to dispatch with my disclaimers. I am not a dentist. I neither endorse any products nor do I receive any financial support from sponsors or professional organizations. I am a board-certified plastic and reconstructive surgeon. I currently live and practice my specialty in Las Vegas, Nevada. My practice is primarily cosmetic plastic surgery. I have had the privilege of caring for over 10,000 patients, 95% of whom are women and 30% of which are Hispanic. I am fortunate enough to have grown one of the busiest practices on the West Coast. I've achieved this through diligence, hard work, and attention to detail. And the work never stops, and the new challenges keep coming. On my amazing journey, which is what I call my practice experience, I have learned so much and continue to learn so much from my patients. Everything I do for them is based on an elusive concept, a concept that is their definition of what is beautiful. Aesthetics, which is derived from the Greek word perception, deals with beauty and the beautiful. It may be divided into two dimensions. One, objective, admirable, subjective, enjoyable beauty. Objective beauty implies that the object possesses properties that make it unmistakably praiseworthy. Subjective beauty is a valuating concept and is related to the taste of the person contemplating it. So what does that really mean? Beauty, what is it? Some say beauty is an illusion, but you know it when you see it, don't you? I mean, you feel it. It has that effect on you. It's quite visceral. Haven't you ever seen a man or woman that is so beautiful that it almost made you feel queasy? Haven't you? Or is it just me? We use words like enchanted, spellbound, captivated. But how do we define it? How do we describe it? Some of the many formal definitions for beauty include words like possessing qualities that give great pleasure, or satisfaction to see, hear, think about, etc. Delighting the senses, or mind, wonderful, fantastic, extraordinary, incredible. A person or thing that is beautiful has perfection of form, color, etc., or possesses noble or spiritual qualities. A beautiful landscape, a beautiful woman, that which is lovely is beautiful, but in a warm and endearing way, like a lovely smile. They say that beauty is in the eye of the beholder, but that depends on where the beholder is standing or what part of the world the beholder lives. There are also cultural standards of beauty. In this study, the same model has her photos edited by artists around the world to conform with that culture's ideas for beauty. As you can see, all very different, yet all beautiful still. There are artistic standards of beauty as well. The great works of the masters and what is considered beautiful by most in nature both conform mathematically to what is known as the golden ratio. The golden ratio, known as the divine proportion, golden mean, or golden section, is a number often encountered when taking the ratios of distances in geometric figures. This is also known as the extreme and mean ratio, the medial section, divine proportion, divine section, golden proportion, golden cut, and golden number. Some 20th century artists, including Dali, have proportioned their works to approximate the golden ratio. The golden ratio also appears in some patterns in nature, including the spiral arrangements of leaves and other plant parts. Our perception and opinions of this elusive, yet very, very tangible principle is influenced by rapidly changing trends. Whether it is the fluid shifts of fashion, what we were given to watch by Hollywood, what we are instructed to buy via Madison Avenue. Today, the concept of beauty is more vague and in some ways more confusing than ever before in our history. We are inundated with images of posed and puckered, scantily dressed women and men on Facebook, Instagram, and Snapchat, etc. These images change the standards of beauty rapidly and sometimes even daily. We want to know what Kylie Jenner has in her lips and what Kim K has in her rear. How do I know this? My patients ask me this almost every day. They excitedly show me pictures on their mobile devices and nervously scroll through hundreds of images that they've saved on their camera rolls in hopes of some sort of validation that yes, this is it, this is beauty. Being a man firmly footed in middle age, I can personally tell you that what was considered beautiful 20, 30, or even 40 years ago isn't the same as what my patients hope to emulate today. In the last decade of my practice, the average desired breast size requested by my patients has steadily been decreasing. The average implant I currently place in patients is 325 to 375 cc's. 10 years ago, it was 475 to 500 cc's. As requested cup sizes steadily decrease, my patients' desired postoperative butt size is ever increasing. One of the most recent statistics published by the American Society of Plastic Surgery suggests that one gluteal procedure is performed every 30 minutes in the United States. Makes you kind of wonder why. In preparing for this talk, I asked myself the simple question, how can I contribute to this meeting in a way that is relevant? I just wanted to speak about beauty. As my work on this project moved forward and research progressed, I took time to reflect on my personal and professional experiences. I was overwhelmed by the flood of data, images, emotion, and reams of information. In my growing confusion and occasional frustration, I started to notice something peculiar. As I examined the thousands of photos, I began to see something very interesting. While I struggled to take measurements and distill all of this, I had that aha moment. I saw it then, and I see it ever so clearly now. The one thing that is consistent, the universal concept, the element that without which no human face can be beautiful is the smile. That's right, the smile. A beautiful face finds its foundation and is built around a beautiful, healthy smile. But being a man of science, I was compelled to investigate this. In doing so, three important questions had to be answered. First, are there universal standards for what is considered a beautiful smile? The second, what are the elements of a beautiful smile? And the last question, why is a beautiful smile important? I began my investigation by breaking down the smile into components: the lips, shape, volume, and lip proportion; gingival health, color, and appearance; and teeth, color, size, alignment, shape, occlusion, and incisor show. After all, you can't have an amazing smile without great-looking teeth. Let's spend a few minutes examining these a bit further. We'll start with the lips. In 1997, I co-authored a chapter on lip reconstruction in the 5th edition of Grab & Smith's Plastic Surgery textbook, and that's where my romance with lips first began. Across most cultures, since the beginning of recorded history, full lips have been associated with female beauty, youth, and voluptuousness. The lips are the central feature on our lower face. The perfect lip portrays health, youth, attractiveness, and sexuality. One study by David Gunn states that the perfect lip is plump and pillowy with well-defined lip borders, upturned corners. The ratio of the height of the upper lip to the lower lip should be about 1:4 to 1:6. The two vertical lines which run down from the nose to the upper lip, the philtrum, should be well-defined and visible. The lower lip contour should be symmetrical on both sides with slightly less volume in the midline. Finally, the skin on the perfect lip is smooth and well hydrated. When considering the ideal lip proportions, the golden rule is satisfied. When this divine ratio is applied for lips, it translates into a guideline that the upper lip should be about 40% of the total lip height of the lips, and the bottom lip should be about 60%. In the same study, it was shown that women with fuller lips tend to look younger than their actual age. This difference is striking. The volume of lips in both men and women reach full thickness in their 20s and start shrinking between the ages of 30 and 40. Because this age is also the time when wrinkles and gray hairs generally appear, thinning lips make women look older than they actually are. It is understandable that women prefer full and pouting lips like those of Angelina Jolie, not just because they look beautiful, but also because it enhances one's youth. The properties of lips change with age, resulting in thinning of the upper lip and upper lip vermilion border, gradually losing volume and becoming less pouty. Genetics, intrinsic aging, sun exposure, smoking, and repetitive pursing of the lips produce what are known as lipstick bleed lines. Gravity and bone loss due to age and further soft tissue volume loss at the edges of the mouth cause the lip edges to turn downward in a perpetual frown. These are commonly seen as what are called marionette lines. In addition to the volume loss in lips, the lip margin itself may become blunted and look less defined. The Cupid's bow, which forms the center of the top of the upper lip, will also lose its iconic sexy projection and flatten out. By restoring the proportions of the lips so that the lower lips are 1 to 6 times fuller than the upper lips, we can create the ideal lip shape. Currently, dermal fillers are by far the best way to enhance and restore the lips. With proper technique, all the characteristics of the perfect lip described can be achieved with dermal fillers such as hyaluronic acid, which is temporary. In my practice, I am using fat grafts more and more to achieve these to a more permanent end. The next, perhaps most important component of an amazing smile are the teeth and gingiva. Tooth color, alignment, shape, show, and occlusion are critical. Our orthodontic colleagues have always been in pursuit of the ideals with respect to dentition. There has been a paradigm shift in the orthodontic specialty that has changed the fundamental conceptual basis of orthodontics. Greater attention than ever before is now given to the soft tissue aspect of orthodontics. In an effort to create natural aesthetics, orthodontists give more careful consideration to the patient in his or her entirety. The dynamic relationship between the teeth and surrounding soft tissue during and after orthodontic corrections and the patient's facial characteristics are now emphasized in developing treatment plans more than ever before. Guidelines for orthodontists on how to analyze aesthetic factors by viewing patients from the front, and new concepts on how to achieve the desirable characteristics of tooth display in vertical and transverse dimensions during normal social interaction and smiling are more important than ever. Contemporary techniques in orthodontics take the objective aesthetics of the entire orofacial complex involving unity, form, structure, balance, color, function, and display of the dentition into consideration. In addition, the creation of subjective beauty according to an individual orthodontist's preferences may enhance the cosmetic value of treatment rendered to each patient. Smiles are characterized by type, based on incisor and gingival display. Lip coverage of the maxillary incisors in full smiles may be classified as one of 3 types: low, average, and high smiles. The most frequent type, found in about 70% of the young adult population, is the average smile. That reveals 75 to 100% of the upper incisors. Upper lip coverage will always increase with age. Therefore, the percentage of high smiles may be greater among younger age groups and smaller among older adults. There is also an observed sexual dimorphism in that low smile lines are predominantly a male characteristic and high smiles are predominantly a female characteristic. Females have significantly more maxillary and less mandibular tooth exposure than males of all ages. The number of teeth displayed in the smile must also be considered. In one study that was called the California Survey, it was also revealed that in a typical average smile in young adults, the 6 maxillary anterior teeth and the first or second premolars are displayed. The progressive changes with age on upper and lower lip positions are caused by the effects of gravity. Some normative studies on the optimal vertical incisor positions in the faces of persons in different age groups are available. Peck showed that the normal display of maxillary incisors with relaxed lips at 15 years of age was 4.7 millimeters for boys and 5.3 millimeters for girls. The sexual dimorphism is evident in all ages. Dong compared the age changes in maxillary and mandibular incisor display at rest and when smiling, and confirmed the observations that age changes with relaxed lips were dramatic. Mandibular incisor display shows a corresponding increase with age. The amount of mandibular display after age 60 is approximately equal to the amount of maxillary incisor display before the age of 30. Tooth display in speaking may be every bit as important as tooth display in smiling to express personality and age. The most important information related to aesthetics and treatment planning can be obtained when the patient is observed during normal conversation. Tooth display on smiling will not provide the same information, since when a person is smiling, the upper lip is raised actively by 3 different muscle groups. For this reason, nearly everyone, irrespective of age, will display maxillary incisors nicely in a full smile, even if the mandibular incisors are visible during speech. In other words, the age changes in incisor display are much more pronounced and apparent with the lips relaxed and when the patient is speaking than when he or she is smiling. The sagging of the perioral tissue is partly due to the natural flattening, stretching, and decreasing elasticity of the skin. With advancing age, the upper lip becomes longer and hides more of the maxillary incisors, while the drooping of the lower lip gradually exposes more of the mandibular incisors. As a consequence, show of the maxillary incisors with relaxed lips signifies youth and beauty, whereas display of the mandibular incisors is a characteristic of the elderly. The importance of the vertical dimension in tooth display has been demonstrated in prosthetic dentistry. For this reason, a guide for tooth position planning in orthodontic treatment should start with an appraisal of the position of the maxillary central incisal edge relative to the upper lip. Okay, so now, with the art, mathematical evidence, and supporting science discussed, the question that must be asked is, what do we really want? What do our patients really want? Why do our patients come to us for help and trust us with their care? Just a few of the answers I've gotten include issues with self-esteem, body image, social anxiety, to stay competitive in a young job market, to save a current relationship, to have greater confidence to get out of an old relationship. It may be to succeed in business, to fill up their social calendars, or get more romance into their lives. The one sure step towards achieving any of these goals might be to work on their smiles. What does your smile say about you? There is so much power in a smile. It conveys confidence, warmth, and certainty. Your smile, simple, straightforward, and most important, sincere, can attract more than just admiring looks. A smiling face tells people that you're an outgoing and intelligent person, worth getting to know. Pamela McLean, a past president of the American Academy of Periodontology, states that when somebody has a big smile, it shows that they're willing to open up and expose a part of themselves. Over the long term, smiling can benefit your health, perception at work, social life, and romantic status. With that much at stake, it's worthwhile to discover what your smile is saying about you and how to interpret the smiles flashed your way. Dr. Lily T. Garcia, past president of the American College of Prosthodontists, asserts that a smile makes you look successful. A smile conveys confidence and professionalism. People who project a positive outlook are generally more open and flexible. They tend to cope better with challenges than people who are withdrawn and unsmiling. Another study that followed a group of women for 30 years shows the lifetime benefits of smiling. The women who displayed genuinely happy smiles in their college yearbook photos went on to have happier marriages and greater sense of well-being. In the same study, a group of strangers looked at the college photos and reported their assumptions about the women's personalities. The women who smiled were judged to be more positive and competent than those who didn't. So, do you want to be happy? Just smile. Believe it or not, forcing yourself to smile can actually make you happier. Dr. Paul Ekman, a psychologist who is an expert in facial expressions, taught himself to arrange the muscles in his face to make certain facial expressions. To his surprise, he found himself feeling the emotions that he was mimicking. When he raised his cheeks and parted his lips and turned the corners of his mouth up, he felt happier. Ekman and his research partner went on to do a study of college students to see if they, too, would feel happier by making themselves smile. The researchers measured the students' brain activity while the students followed instructions to smile using the muscles in their cheeks and around their mouths. Whether the students smiled spontaneously or on purpose, the activity in their brain was virtually the same. They felt happy. Smile anxiety, a term coined to describe the emotional complex experienced by patients with poor dentition, was described in a paper by Dr. McLean. She explains that chipped or missing teeth, fillings, or discolored teeth are unveiled when your lips part to smile. So some people simply avoid it. She goes on to further state that if you find yourself wanting to cover up your smile, you could be holding yourself back in more ways than you realize. Life is much more challenging for people who are so self-conscious about their teeth that they don't want to smile. But let's remember one thing. The smile stuff is not all about vanity. There are real, proven health consequences associated with poor dentition, resulting from poor oral care and periodontal disease. A paper written by Barker suggests the existence of the mouth-body connection. Data from the American Dental Association supports this, specifically stating that people with serious gum disease were 40% more likely to have a chronic condition on top of it. The mouth is the gateway to the body. Bacteria that builds up on teeth make gums more prone to infection. The immune system moves in to attack the infection and gums become inflamed. The inflammation continues unless the infection is brought under control. Over time, inflammation and the chemicals released by the inflammatory process eat away at gums and bone structure that hold teeth in place. The result is severe gum disease known as periodontitis. Inflammation can also cause problems in the rest of the body. I'm sure none of this information is new to my audience here today. Diabetes, heart disease, premature birth, osteoporosis, rheumatoid arthritis, COPD, and obesity are just a few of the conditions that may have strong connections to periodontal disease. The working relationship between diabetes and periodontitis may be the strongest of all the connections between the mouth and the body. Inflammation that starts in the mouth seems to weaken the body's ability to control blood sugar. And although the reasons are not fully understood, it's clear that gum disease and heart disease are related. Up to 91% of patients with heart disease have periodontitis. The theory is that inflammation in the mouth causes inflammation in the blood vessels. Researchers are even looking at the possible role of gum disease in premature birth. Infection and inflammation in general seem to interfere with the fetus's development in the womb and may contribute to premature birth. Treating periodontal disease has been shown to reduce pain associated with rheumatoid arthritis. Periodontal disease may make pneumonia and chronic obstructive pulmonary disease worse, possibly by increasing the amount of bacteria in the lungs. 2 studies have linked obesity to gum disease. It appears that periodontitis progresses more quickly in the presence of higher body fat. One thing is certain, the body and the mouth are not separate. Taking good care of your teeth and gums can really help you live longer. In putting this all together, by now a few things should be very clear. There is a perception of health and vitality that is associated with all things beautiful. Healthier things just look better and more beautiful. And what looks good or beautiful makes most of us feel good. As providers, the simple act of smiling or sharing that amazingly healthy smile with our patients is good for our own health as well as being good for our business. Our patients interpret our smiles as confidence. Our smiles make us seem warmer, more human, and approachable. Patients are more likely to trust and seek services from confident, warm, approachable providers. So if you'd like to be happier in general, desire better relationships with your patients, staff, friends, family, and romantic interests, if you want your practices to be busier and your bottom lines to be more impressive, remember, first, brush and floss every day, and that's a given in this room, And try this simple experiment. I challenge you to smile as often as possible for the next 30 days. Even when you don't really have a real reason to smile, just do it. In the least, you'll look better most of the time. And happier people are more beautiful in general, aren't they? I'd like your feedback on this. You can email your comments or observations to drstile@hotmail.com. So smile. It's good for you, and you'll be more beautiful for it. Thank you.